I help keep patients safe is working with the staff recently in a project recognizing the early signs and symptoms of a septic patient in our ER. Because their mortality rate is so high, we want to recognize those symptoms early and try to initiate the appropriate order sets to maximize our treatment process in the ER and then into the ICU.
I help keep patients safe by participating in the medication management team that looks at the medication use process, looking at things from dispensing to barcoding medications to checking drug interactions.
I'm Katherine Sartorius. I'm a physical therapist, and I work to keep patients safe by always using a gait belt when I'm working with patients and making sure that we have a clear path before we get up and move around.
My name is Karla Mckim. I'm a physical therapist as well. I make sure to keep my patients safe. When I'm finished with a treatment, I make sure they have everything in need. They have their call light, everything close by, such as the phone, and just make sure that they don't need anything else before I leave the room.
I'm Rhonda Cooper. I'm the wound care coordinator for Capital Region, and I make sure that patients are safe, skin protection so we don't get pressure ulcers on admission. Once they're here, we want to make sure they have all their interventions they need to keep their heels up off the bed, air mattresses if needed, that physical therapy is working with them to get them up out of bed when needed, and doing skin assessments with every nursing assessment.
Hello, I'm Nicki Blochberger, and I work at Capital Region Medical Center. I work in the Andrew M. Giuliani Laboratory, and for patient safety, we make sure we identify the patient correctly by using two identifiers. Basically, the medical record number, which stays constant, and the date of birth. And we make sure that we don't have clutters in our hallways. We have a lot of equipment, so we make sure that we don't trip over those. And we do especially hand washing because we don't want to spread infections, and that's part of the good safety for our patient.
Hi, my name is Diane. I'm a patient care tech at Capital Region, and I keep my patients safe by making sure that there's no cords on the floor, make sure there's nothing slippery on the floor. The bed is in a lower position to where they can get up properly without slipping. I try to make sure that the ones that need it have a bed alarm on. My goal is to make sure that my patients is safe and taken care of in the proper way.
My name is Carol. I work at Capital Region Medical Center, and I keep my patients safe by putting up wet floor signs and reminding patients and family not to walk on the floor for at least 10 minutes until it's dry. And I always make sure that I move any kind of obstacles around in the room that they could trip over.
Hi, my name is Denise Branch. I'm a transporter for Capital Region Medical Center in the Radiology Department. I help keep our patients safe by having the nurses fill out the ticket to ride whenever we go get a patient to take down for tests. When we bring them back, we make sure that we have the beds are locked. We make sure they have their call lights within reach, their tables, their phones, and we always ask the patient if they need something before we leave the room, if we can get them something else.
Hello, my name is Latonya. I work in the EVS department, which is Environmental Services, and we keep our patients' safety by keeping a clean environment.
I'm Tiffany. I work up on PCU, and I keep my patients safe by frequently rounding on them and making sure their bed alarms are on.
Hi,
My name is Carolyn Ayala, and I work in Capital Region as a patient care tech. I take care of my patients by answering phone lights and meeting my patients' needs.
Hi, I'm Dr. Smith-Haxton. I'm an obstetrician gynecologist at Capital Region, and I keep all my patients safe by providing them with the best medical care.
Hi, I'm John. I work in the maintenance department. My main job, or one of our main jobs, is to keep people safe. We do safety rounds, do safety checks, and take care of the environment, care for patients.
On behalf of the administrative team here at Capital Region, I want to extend my gratitude and thanks to all the caregivers and all of our team members in promoting a culture of safety here at Capital Region. It's probably our most important job to keep our patients and the families of the patients are entrusting us to make their loved ones safe. And so I want to thank everybody for that, and appreciate everybody's efforts and to make everybody better every day.